I would like to invite Mr. Prashanth Prakash, founding partner of Accel and the first donor to our Longevity India initiative, to give a keynote address on the longevity industry in India.
Very good morning to everyone. I think this has been in the making for a while, and really glad to see that it's real today and we are all here. So, my own journey has been, in these buckets of 10 years. And in the late 90s, it was the internet and cloud era, and that's where I started my life as an entrepreneur here in India. And then the next was the e-commerce era from 2005 to 2010, where we were able to work with some of the best entrepreneurial minds and change the whole ecosystem of people innovating in some other country to stay back here and innovate here in India. So it was a very dramatic shift that we were able to in those days do. And then in the last decade, I think it's about the broader democratization of entrepreneurship in the country. It's no longer about urban India. It's now entrepreneurship is about Bharat. It's about touching everybody in this country. So, and this next 10 years, I see myself at this huge confluence of health and AI and kind of our nation's state, which Deepak spoke about. And I see that as a big mission for myself, and that's where we are today, right? So just wanted to set my own personal context, and I'll talk a little bit more about that. But today I'll spend the next 15 minutes kind of what I think is a high-level India, kind of present the case for an India moment, like all other leapfrog moments we have had in this country. I really believe that Medicine 3.0 is an India moment, and I'll kind of make a case for that. So, unless we are living under a rock, I don't think any of these names are alien to any of us, and we have, of course, seen or heard something about them. But what I'll try to cover today is hopefully some new ground, which is, like Deepak was saying, the India context. Why is it that, a confluence moment in India and what's happening here? So that's what I'll try to cover. I think Deepak kind of covered this aspect here and how there is a shift in aging. And the only thing I'll say here, in addition to what Deepak covered about this mindset change, is that I think the layer of entrepreneurship that we can bring to play in India for this, and this is not entrepreneurship in small levels, right? So for everything in India, we're able to get thousands and thousands of entrepreneurs to work on problems and really solve it in the India context and in a very different manner than what anybody has done in the other parts of the world. So I think that is really what makes this really exciting. But for me, my own personal interest, where did I get started in this space? Maybe about 6, 7, 8 years ago. Like everybody who starts in this space, you first start to understand what everybody says. Okay, you got to understand the hallmarks of aging. So you get into that rabbit hole, and then you realize that, there's so many nuances there. There's an hierarchy there. Everything influences everything. Just measuring one thing means nothing, right? So, and we debate a lot, what does this whole biological age really mean? And are we anywhere close to understanding what our biological age is? And I really believe we don't. And that's a big opportunity. I mean, all these are the fact that we think, like Deepak was mentioning, like we think that we have solved a lot, but in reality, we have not solved, we have solved very little, right? And that's the huge opportunity. But for me as an engineer, starting a life as an engineer, I think it was an aha moment, that, okay, you know what, I don't have to be a scientist. I don't have to be this molecular biologist to really make a difference in this space. And this broad system level understanding is kind of more important. The whole system is more important. It's not, I mean, like the analogy of a car, right? So it's not about that, that precision gearbox that is next gen, but it's about how that drives every component of the car and makes sense of the car, right? So I think that kind of, in some sense, came naturally to me as an engineer, and I think that was kind of the new, and that's the whole convergence in IISc2 today, right? So that it's no longer about just science, engineering, it's all and clinical, the clinical hospital all coming together. So, at, at a level deeper, uh, I was not only an engineer, but a software product engineer. So, so understanding, the elegance and the marvel of this software-like system, multi-scale, resilient, autonomous, yes, yet cooperative, was very fascinating, and just, like I said, just got me even deeper into this rabbit hole, right? So that's kind of how I got a lot deeper. Uh, so, just switching gears, then I was like, okay, fine, this is an opportunity. Now, what does this opportunity mean for our country, and what does this opportunity mean for us as entrepreneurs, right? So you have to ultimately take it to your people, right? You got to take it, you got to make a product out of it, and what is that product? And what is the relevant context of the product, like Deepak said, in today's day and age. And this is where, this 200 years of medicine, I think, is coming to a point where, people have to rethink uh, the role of a physician, rethink the role of a hospital, rethink the role of all the tools that we today pay a lot of money for and use because we think it's going to solve our problems. So, and this medicine 3.0, I think, which and I think I'll talk a little bit more. I think there's been a lot of uh, early work by the functional medicine folks, but I'll tell you why. Unfortunately, they were handicapped. They didn't have the right tools. So functional medicine still was a little bit of a trial and error thing, right? So they were still looking at disease states and trying to make sense of the disease state and work backwards from that without data and still make a difference. I mean, their intentions were right, I think, and hats off to them that they spent a lot of time at least changing mindsets that, you got to look at root causes, you got to look at things differently. But unfortunately, I think technology and data didn't support them, and that's where this I mean, I've seen this so many times. Inflection happens when new nomenclatures get developed. Cloud was always there, right? But once somebody coined this term cloud, it created a few $1 trillion there. So I think if functional medicine or preventive medicine, wellness medicine, I mean, whatever you want to call it, is still there. But when you repackage something, and it actually, you can remove the old baggage from it, and somehow removing that old baggage from that term lets people imagine it in a more wider canvas, and that wider canvas then leads to entrepreneurship, right? So I think while people think that it's the industry trying to just make money, I don't think it's the industry just. I think sometimes it's really useful and important to kind of reset a particular field, and I think we are in that moment in longevity, like Deepak spoke about, where we are kind of resetting old notions and conventional thinking here. So what are they, and really this slide is the pivotal slide, because I think it is these multitude of innovations that all have come to some prime time. What makes something really relevant in terms of an engineer, a product person, or an entrepreneur really taking something to market? It has to be affordable. It has to be something that even if you start out with the slightly more expensive parts of society, very soon, the law of scale, the laws of scale catch up, and you're able to kind of make it a lot more affordable, and it becomes a lot more pervasive. And that's when you have these huge startup opportunities that come up. And I think whether it's, so we'll talk a little bit more about precision medicine and why it is that precision medicine element that actually is changing the game, right? It's that black box that we have been dealing with as clinical, I mean, we are dealing with two things. One is it's a black box, and then we are dealing with end state blood chemistry and some of that, and we are trying to then make informed decisions by clinical knowledge, which is at a very gross level. So I think that so that whole field changes with precision medicine, and that's really a big game changer. And regenerative therapies, it's been like 2 decades in the making, right? Whether it's stem cell therapies, like exosome therapies, there's many of them, and they also have gone through their own cycles. And I think I'm seeing that moment where we'll really start to see how some of that is again ready for prime time. Of course, with the right amount of caution. But I think the interplay between precision medicine and these therapies is very important to understand. You cannot make sense of those therapies again at a gross level. You're again shooting in the dark, right? You're doing like a bazooka approach to things, right? But the same therapies, when you are more targeted, start to make a lot more sense. So I think that's, and of course, the technology for continuous monitoring and totally constantly iterating the algorithms that help you keep you in this homeostasis state, I think is going to be very key. So I think, so this whole movement from this, I think, like I said, the holy grail was personalized medicine, which was driven by cohorts of clinical studies and cohorts and years and years of clinical knowledge that clinicians acquired and used that to inform their decisions on whatever therapies and so on. So I think that now being this whole N of one medicine, right? So being able to tailor it, and not tailor it again with trial and error, right? And not tailor it again with a one size fits all or an approach. I think the biggest issue still in this field is this idea that I have an approach, and this approach is going to solve everybody's problem. No matter what, I see this across all social media influencers. They all say that they have an open mind, but I think somewhere their biases are always driving every aspect of their narrative, and sometimes it's because they're commercially compromised, and sometimes it's because maybe they really truly believe in a few things. But that is, I think, there's a huge change there. And so what's the, so this idea of multi-omics, and for a few of us, this is something that in the last 2-3 years we started getting familiar. But for people in science and research, it's always been there. But the problem has been, how do you kind of take it out of that lab, and how do you take it out of the academic realm, and how do you then make sense of it and apply it? Required again the evolution of machine learning, and this is huge amounts of data, right? So it's the genome was small, that's like 1 GB, but if you're talking about your gut data, then you're talking about 100 GB, and you soon have terabytes and terabytes of data. So being able to normalize data, get normative data out of that, being able to integrate that data, and then being able to derive features from that data using machine learning, statistical models, and then running inferences on that, right? I think is really something that in the last 2-3 years, I'm seeing this as being more and more practical and now really applicable at a large scale. Um, so I think there is, I mean, this field is still constantly evolving, right? So while like I said, you look at the biotransformations that happen in your gut, the kind of metabolites that you get out of that. Then you measure those. Now there are multiple ways of measuring those metabolites. You can do it at the stool level, you can do it at the urine level, you can do it at the plasma level. But all these ability to measure these metabolites is becoming more and more practical. And from that, you understand then these 80 metabolic paths, because people used to always, I mean, everybody tells you, right? It's all about metabolism. It's all about metabolism. But it stops there, right? What about metabolism? What really, what sequence of genes, what sequence of, metabolites in your pathway is actually dysfunctional, has no throughput, is clogging your pathways? Nobody knew. So there is really, it's really a very, very transformative moment in terms of knowing what's happening and just kind of at a very high level saying, okay, this is important, that is important, right? So, and now let's take it to the next level. So one, at the first level, you're able to look at, what's in these 80 odd metabolic pathways, right? Really what's going wrong. And if you're able to then intervene therapeutically and change, and it's not always through supplementation necessarily. I mean, it's through lifestyle and sometimes supplementation, but supplementation should be again used to get maybe these pathways to a sustainable state and not depend on them forever. But that's a whole different topic. But I think this idea of digital twins is very interesting, right? So this being able to kind of get your genes mapped to this twin, to this digital twin, and then map your biology, the current biological state to that, and then you get an understanding of the difference between your optimal state and where you are today, and you kind of iterate on that. And this idea of testing, so one big shift that's going to happen, I think it's, I'll talk about it and then I'll go back. So I think this whole idea of, testing was a episodic moment when yearly moment, or you have a specific problem and you go and get your blood test done. I think the idea of testing will change forever with this new paradigm of precision medicine, right? So you got to test yourself. I mean, it's my prediction that 10 years from now, we'll have a continuous ability to test. I mean, that's how, it'll almost be a weekly ability to test, right? So it's not even monthly. But I think we are at a state where maybe we can do a quarterly test on ourselves, right? So, and being able to monitor that, right? And leverage this multimodal confluence of all the data at your disposal, and kind of at some level, at a Gen AI level, use it for your own comfort to interrogate and understand where you are. I think that's a big application of Gen AI in terms of once you have all this data, both for, so at a overall level, the way I see precision medicine working is you have the AI model in the center, right? Then you have the scientist, you have the physician, and then you have yourself, right? And I think the kind of the synchronous way of working of all these three people working with the AI model, I think will also be very, very different and something we are not used to, because we have not, in a sense, we as patients or we as people who go to doctors or talk to scientists have not been kind of equals at at the table, right? So that being an equal, because with this power of AI and being able to interrogate this AI and be as informed as the physician or as a scientist with the AI model, I think is very, very huge and is a big game changer. So going back to these therapies, sorry. So I was talking about these therapies, right? So I think all of these, and like Deepak was saying, I think on the small molecule interventions, I think we have done a very poor job. So after all these years, we still don't have one small molecule that can really change anything. I think we have some very broad strokes, things like, okay, calorie restriction works, but then how and what form. But that aside, I think there are, definitely lots of huge potential, and I think now good clinical trial data is coming up on. Take something like stem cell therapies, right? So there are good there is good trial data now to show that you can actually stimulate through plant compounds your own stem cells without any external infusion of stem cells, right? So I think there are some very interesting therapies. Here, again, we'll have a little bit of an India challenge. I think some of these will require, there's a huge education to the regulators, which of these are really validated, and how do we get there? So I think that's a different challenge. I think I'm just running out of time. But what's the? I mean, all this is great, but for entrepreneurs, what does it mean? So here's my kind of hypothesis or theory that we will leapfrog the world when it comes to longevity. And why is that? It happened with us on the mobile technologies because we didn't have any capabilities there in telecom. It happened to us in the digital payment space because we had no payment industry here, right? And I think it's very similar in the longevity space, and we don't have the baggage of the health system pharma nexus that exists in the West, right? I think in a sense, I think, this is the country where you are able to, through generics, right, really, have some of the lowest cost of healthcare in the world, right? But where have we made a lot of news? By being a country with the hospital that does the largest number of surgeries in the world. I don't think that's something that we should be really proud of, right? So I think what we really need to see now is how can we use this idea of precision medicine to leapfrog the rest of the world, and the hospitals of tomorrow, right, which I just spoke about, right? The models for that have to come out from India. And as entrepreneurs, I think there is not only the overall opportunity to create how many of you know, right? Manipal Hospital today is a few $billion. So I see the next 10 years a very new kind of hospital, which foundationally is based on some of the things we spoke about, will be a few $billion, right? Then there are all the tools, and then there is the infra and all the things that enable a hospital like that, right? So I'm saying we are talking in the next 10 years, at least a $50 to $100 billion worth of opportunity for us. And this opportunity is part delivery here, and it's part being the back office for some of this for the rest of the world. When it comes to testing, I think, like I said, the whole paradigm of testing is going to change. And I think India can become one of the largest, it can become one of the largest opportunities for the country to be this multi-omics back office for the rest of the world. And so I can go on and on, but I think in the interest of time, I would like to say that never been more excited about, and like I said, my excitement changes every 10 years, and now this is a new one. But I really thank Deepak and Surma and the entire team here to kick this off, and hopefully this will be one of many, and look forward to creating this $50 to $100 billion of value over time. Thank you.